Okay, I think we will make a start. Welcome to this lunchtime session. My name's Shantha Rajaratnam. I'm a professor and the head of the School of Psychological Sciences at Monash University. And I'm a psychologist by training, and it's a pleasure to chair this session. I want to start by acknowledging that we're meeting on the unceded lands of the people of the Kulin Nations, and I want to pay my respects to elders past, present and emerging, extend that acknowledgement to anyone who may be joining our session today from First Nations communities, and also recognise that First Nations people have been meeting on this land for millennia and have been connecting with community and have been caring for community, and we have a lot to learn. Today, on the panel today, we have some experts in the area of workplace mental health and wellbeing. And I'm going to just start by introducing them to you. So we have, over on my right here, we have Professor Karen Walker-Bone, who is Professor and Director of the Monash Centre for Occupational and Environmental Health in the School of Public Health and Preventative Medicine at Monash University. I'm going to ask each of these panellists, in their response to the first question, to share a little bit about their perspective in workplace mental health and wellbeing. We have Professor Alex Colley, who is Professor and Director of the Healthy Working Lives Research Group and the Division of Health Systems, Services and Policy at Monash University, also in the School of Public Health and Preventative Medicine. We have Margot Lydon, who is the Chair of the Mentally Healthy Workplace Alliance and an Honorary Fellow at the University of Melbourne. And we have Liam O'Brien, who is Assistant Secretary at the Australian Council of Trade Unions, the ACTU. So thanks for joining us. Feel free to move a little further forward if you like, so we can be a little more, but that's fine as well. So today we're going to be talking about, the session description is in the program, so I'm not going to go through it again, but just to highlight some key areas in the context of global health, which is what we're here to really focus on at this meeting. We have a number of challenges with respect to workplace mental health and wellbeing, which we're going to unpack in this discussion. Now, beyond our moral duty to prioritise health and make sure that work is safe and healthy, we also recognise, and increasingly, the impact of poor mental health on productivity in workplaces as well. We know that, for example, some economic modelling work that has been done identifies that depression and anxiety are estimated to cost the global economy a staggering $1 trillion US. And this is driven predominantly by lost productivity. We know that there has been a number of comprehensive surveys of workplaces that have revealed alarmingly high levels of poor mental health in workplace settings. We know that a number of international organisations have really put out a call to action in this space. The World Health Organization is one of those, and the World Health Organization in 2022 set out a comprehensive set of evidence-based actions aimed at protecting mental health conditions and promoting well-being in workplaces. And we're going to touch on some of those today when we talk about the multiple levels at which we really need to see action in order to really curb this rise and this tide that we're seeing. So with that context in mind, I'm going to open up the first question, which is to really think about, and I'm going to ask each of the panellists to reflect on this, what are the current challenges and barriers to creating mentally healthy workplaces, mentally healthy and safe workplaces? I'm going to start with Karen.
Thank you very much. And I too would like to acknowledge that we're on unceded lands and pay my respects to anyone in the room from a First Nation. So I think what I want to say first, Shantha, is that we have to remember that we're all human beings. We have our mental health 360 degrees of the day, so we take our mental health with us to work. Obviously, what happens to us at work can have an impact on our mental health, but equally, it must be remembered that it can be good for our mental health. So we have two issues here. We have protecting people from workplace challenges that increase their mental ill health, but also creating workplaces that are accessible, flexible and supportive no matter what your current mental health is and what your situation outside of work is, because life is complicated and we all have things in and out of work that are impacting our health both physically and mentally at any point in time.
Thank you, Karen. I'm going to go to Liam next, please.
So thank you, Shantha. I'd also like to acknowledge country. So I want to pick up on where Karen started off, and maybe the first thing I would say is that, as Shantha said, every worker has the right to a safe and healthy working environment, and that's been something that our movement has been founded on. But it's also something that recently has been confirmed as a fundamental principle in right at work, as the ILO added it to its fundamental principles and rights at work 2 years ago. For us, and I think for most people think about health and safety and they often think about the physical hazards at work. They think about a construction worker going onto a building site and dealing with physical hazards, and that absolutely is a serious issue. What we've been really focused on as a movement is getting people to think about mental health as a really significant part of workplace health and safety. And so for the last 5 years, we've pursued a lot of reforms about closing that gap, both in terms of the laws. So we have a work health and safety framework that provides those high-level duties but doesn't prescribe specific actions in relation to mental health that it does, say, for the construction worker or the manufacturing worker who's exposed to physical hazards. But also to start to shift community attitudes so that people are much more aware about both their rights around health and safety in a workplace context, but indeed their employers' obligations to design work that is both free from physical harms but also psychological harms. And I think that last part has been the part that has seen the most shift in probably the last decade across the country, that people now have a much stronger expectation that work is both physically healthy but also psychologically healthy.
And Liam, we're going to pick up on that comment about how to create that psychologically safe environment in a moment as well. Alex, I want to come to you next to get your perspective on the barriers and challenges that we see currently from your perspective.
Thanks, Shantha. My point is, attempt to sort of draw some of those points from Liam and Karen together. I wanted to start by just, acknowledging that in this country and developed economies like Australia, if it's not already, it will soon be, what that is workplace mental health, will probably be the set of conditions that lead to the greatest burdens of disability and disease and illness and injury amongst our working population. And that's because of the shift that we've seen in our labour force over the last 10 or 20 years towards a much stronger service-based economy. And we really see this already in some occupations, and it was very evident during the COVID pandemic in frontline healthcare workers and police, exposed to other members of society not always at their best, where we saw some of these risks really playing out. And so I think that obviously as a sort of population health problem, and I think one of the barriers to that has been, and it's beginning to change, is that we have historically left it up to individual actors to deal with the problem, so employers or unions or WHS regulators, and it's really a multi-system challenge. And so a sort of connected systemic approach to addressing what I think will become the biggest health challenge in our workplaces over the next 10 or 20 years is what we really need.
Thanks, Alex. And Margot, I wanted to come to you, and perhaps if you could also just give the folks here a little bit of context of the Mentally Healthy Workplace Alliance as well. Thank you.
Thank you, Shantha, and good afternoon, everyone. I too would like to begin by acknowledging the traditional custodians. So I think when I look back over, the last 10, 15, 20 years in workplace mental health and wellbeing, I think we've got to recognise that it's a maturing system, that it's still fairly embryonic in many regards. And certainly when you traverse, the Asia Pacific areas, some of the other countries around our globe, this is very much, as Liam said, a physical issue, and we haven't even sort of started to even have conversations about psychological health and wellbeing more broadly. But here in Australia, I think we're fortunate. We've been at the forefront of workplace mental health and wellbeing for some time now, but we're really at a tipping point. And that tipping point is not only driven by changes in legislation, changes in environmental and systems approaches, the recognition off the back of the pandemic that, hey, everybody has mental health and everybody has been impacted. We've got 5 generations in the workforce. There are so many different elements that are driving a different conversation just in the last couple of years here in Australia around workplace mental health. And that whole notion of productivity, I think, is a really important conversation for us to unpack in the realm of wellbeing more broadly. So as chair of the Mentally Healthy Workplace Alliance, I'm very fortunate to hear from the insights and wisdom, the practical application by unions. So Liam is on the Alliance, but we've also got employer associations, we've got community organisations, Beyond Blue. Georgie Harmon was just at a previous session. We've got Sane Australia, the Black Dog Institute, who I know was represented in one of the previous sessions. We've also got the Australian Faculty of Occupational and Environmental Medicine. We've got our regulators with Safe Work Australia and Comcare representing what is happening on a regulatory and a safe work perspective. We've got the National Mental Health Commission. So it is an alliance of what I would describe in these safe walls as 13 healthy, happy cats, but they're cats all the same, and trying to herd the cats in the direction of creating for Australia mentally healthy workplaces in every organisation for 13.8 million Australian workers. So no short feat to try and bring about the change that we need to see, which really goes back to that my first point, and that is we are still maturing this system. We are still learning about what works. And my biggest area of interest is in that practical implementation, the support that we can give to employers and workers to really bring about the change that everybody will benefit from.
Thanks, Margot. And so, Liam, I want to pick up on a point that you made, and I think that really resonates with me, that every Australian worker has the right to be in a workplace that is physically safe and psychologically safe. Just looking at that psychologically safe, mentally healthy, whose responsibility is it to create that kind of environment? Because just before while you're thinking on that, we've heard at this meeting the complexity in health systems, and when we talk about moving outside, for example, a traditional public health system into a workplace, we're talking about a complex system where there are many people involved and many people that have a role as well. And we just heard that from Margot in the kind of alliance that she's leading. So interested in your thoughts.
Yeah. So I think to pick up on the point that Alex made, it is a complex system. I think if we think at a systems level, I think we can have a much broader discussion about who has agency and responsibility. But let's start at the workplace level, because I think this is pretty simple. Employers have obligations to ensure that work is safe and healthy. And there are some words in the laws that talk about so far as is reasonably practicable, but arguably that is where the obligation exists. It exists for health and safety in relation to physical hazards, and it also exists in relation to psychological hazards. And we've come a long way, as I said before, just in the last few years to build out a framework of standards about how employers are supposed to identify and control psychosocial hazards in the workplace. But if we think about it at a systems level, the range of actors is much broader. Obviously, and I should say in the workplace, workers have agency, and indeed they have elected structures, unions, health and safety reps that should be engaged in the coordination of health and safety, not just for physical hazards, but equally for psychosocial hazards. But if we step back to the systems level, absolutely, we've all got work to do here, whether it be unions, employer organisations, health and safety regulators, but even when we think broadly about public health and population health, there are things that we should be starting to look at which are far deeper than any particular actor can deal with, that require a whole of community response. If we think about just what Alex picked up on the changing nature of work, I said before we stepped up here, one of the things that really strikes me as a union official who is responsible for health and safety is that the task of the people that had my role a generation ago was very different. The common occupation was one that was physical and routine. The types of injuries that workers were being exposed, the types of hazards workers were being exposed to were predominantly physical. That is not the case today, and indeed it will not be the case in the future. Much, much more of our work is cognitive and non-routine. If we think about where AI potentially takes us, it's going to really accelerate those changes. But we've also seen some really big challenges in our labour market. The rise of insecure work, the creation of gig work, creates a whole lot of challenges for how work and mental health interact. And so I think we do need to think as a community about how work is organised at a systems level if we're going to address, which Alex rightly points out, is probably the biggest challenge we face, which is that mental health is going to be the driving issue in terms of occupational illness going forward.
Thanks, Liam. Margot, I wondered if you would pick up on that, the question of who's responsible and the various actors in this space.
Everyone. In a single word, I think it comes down to how do I turn up at work, how do I turn up for myself, but also how do I turn up for my colleagues, the people I interact with in the case of healthcare, patients and the general public that we might be interacting with. It comes down to every single one of us. And yes, we absolutely, Liam's spot on, the systems, the laws, the practices and the processes are very much employer responsibilities. But I do think we as individuals also need to recognise that how we turn up at work for ourselves and our own health and wellbeing, and how work can be fuelling our wellbeing or not, and also impacting on those around us is really, really important. I think the other element I'd put into the mix here is we've got to recognise that systems and structures can have detrimental impacts even if we as individuals are doing the very best we possibly can. So it's not an or situation, this is very much an and I'd really love for Australian employers around the country, for our regulators, for the benefit design systems of the insurance scheme agents and the like, life insurance agencies, all sorts of players to come together, and I know we're going to be talking about that later, but it is very much a collective. How are we going to improve this for everyone as well?
I really like that idea of kind of the collective responsibility, and in my area, so I work in sleep research and in shift work, for example, and often when I'm coming into an organisation, we're looking at the variables that influence whether or not a person is exposed to risk in shift work, and there's a lot of things that an organisation and an employer can do to mitigate those risks. But there's also things, as you described, Margot, where an individual walks into a workplace and, of course, they walk in a particular state of fatigue or being rested, determined by what they've been doing before they got there. And so it's a clear example of how there is a collective responsibility in order to, perform safely and effectively in the workplace. Karen, I want to pick up on the point that you made early about the fact that mental health hasn't got geographic boundaries. You don't step into work suddenly and become, your state of mental health doesn't just, drastically change at that point in time. It's a connected, it's connected more broadly. In what ways do you think work-related ill health impacts upon our broader lives, the broader health system as well?
Oh, for sure. I mean, this is all a two-way thing. Undoubtedly, what you bring to work in terms of your mental healthiness impacts on your performance at work and your relationships with the people you co-work with, including your boss. But also, very sadly for the family, if you take home a lot of stress from your workplace, had a particularly bad series of events or you've been bullied, undoubtedly that will have a marked impact on yourself, but also your relationships outside of work and your family. And we know that's, very severe. We also know that if you fall out of work and become unemployed through any health condition, you and your children will have a poorer life because of it. They're less likely to be mentally healthy and they're less likely to have good work in the future. So the consequences are far-reaching. But I don't want you or the audience to think that we don't know the solutions to this, because we do. We absolutely do. What we need is a step change in our thinking. We've talked in health and safety about prevention. We actually know that if the leadership of an organisation leads on the front foot towards promoting a healthy workplace, they can lead the whole organisation with them towards giving flexibility to each other, being kind to each other in the workplace, listening to each other. We can create mentally healthy workplaces that are nicer to be in, that can look after us and can prevent damage. And then the hazards part of it is secondary, it's lower down. We're not talking about prevention of damage, we're talking about promotion of health. And that's what I'd like to move towards.
Alex, what are your thoughts about the way in which we're seeing workplace mental health or impacts on workplace mental health play out in a broader health system, public health system?
I think if we think about the system of healthcare that we have here in Australia, one of the real points of tension, I think, is in primary care. So our general practitioners pick up much of the burden of diagnosis and management and treatment of people with work-related mental health conditions. And that's a really challenging thing for a lot of GPs. We've run and published a number of studies that have sort of characterised the complex interplay that goes on in primary care when workers arrive in a general practice with a mental health condition or a series of mental health symptoms that they attribute to work. It's not a routine clinical encounter. It's one that it requires the GP to sort of involve and understand the person's working circumstances and figure through a whole range of other complexities that they may not have to do if they're dealing with another sort of health condition that patient has. And so that's an enormous challenge in supporting workers to stay at work and be retained in the workplace when they're dealing with symptoms of mental illness, or if they've left work to try to get them back in. And I can see some people sitting in the audience who've worked with me and who have led some studies supported by a range of other organisations that have already spoken today where we tried to improve or support GPs in the diagnosis and management of work-related mental health conditions. That's been something we've been focused on for over a decade now with some success. It's a very hard part of the healthcare sector to make progress in, but we have had some success. So I think that's a real point of tension, and it sort of speaks to this multi-system problem, the interaction of employers and healthcare practitioners and insurers who are funding some of those services. That all needs to come together to support retention and reintegration of workers, I think.
Can I just pick up on this point? Because I think this is often something that's missed when it comes to work-related mental ill health. I mean, we've seen a debate here in Victoria about access to workers' compensation for those that are experiencing poor mental health. And absolutely, across the country, we've seen claims rise exponentially, some more than others. But actually, when we think about the financial burden that's really driving some of this stuff, it's actually the time off work that people that are suffering mental ill health experience. It is 4 times longer to be off work recovering than it is for a physical hazard. And so that disconnection from work is such a significant factor, both in terms of the financial viability of schemes, but actually in terms of how claims are being managed. And invariably, many of these workers could be returned to safe work much quicker. It's better for everybody, but we're not managing this properly because we've got this old paradigm, which is if you're injured, you're out of the workplace and don't come back until you're fit and healthy. And in particular, if there's a suggestion that work, as in how it's organised, is hurting you, well, we want to keep you well and truly away, rather than how we should be approaching it, which is diagnosing what is the system of work that's given rise to the injury. And a lot of that will be, this sort of poor portrayal about behavioural issues, interpersonal problems, which are actually born out of culture, work demands and other things that are not being addressed. So even those sort of leading indicators are not pushing back into workplaces to say, how do we manage that problem better? And in the case of mental health, it is significantly worse than in the case of physical health.
And of course, Liam, excellent point following on from Alex's, that work is a significant factor in impacting mental health positively and negatively, right? And Margot, I wondered if you could pick up on that point in terms of, we already know in terms of costs, as Liam described, the unsustainable rise in mental injury claims that jurisdictions across this country and across the globe are seeing. We're also seeing impacts on productivity in workplaces. I wondered if you could just comment firstly on that link with productivity. You represent employers as a part of your Mentally Healthy Workplace Alliance. But the second point about what work, the function of work as it relates to a person's well-being as well.
Thank you, Shantha. Big question. So productivity, when we break it down, it's really about an equation. It's around inputs and outputs. So from the inputs that you have, what are your outputs over a period of time? And I'm yet to meet anyone who is highly productive when their wellbeing is low. I think what we've got to recognise, as Liam said earlier, around a knowledge economy, around the fact that work is shifting from physical to much more cognitively based work and requiring of our, not only our intelligence, but our ability to bring our energy and effort to really complex issues and problems, that work is becoming more and more akin to, the challenges we're facing into. We've got to look at wellbeing as an input. People who have high wellbeing are more creative, they're more innovative, reduced costs, so take less time off work, unplanned leave from sickness, less turnover, less injury. They are delights to lead if you're in a leadership or a management role. These are people you want in your workforce. But what does it take for an individual to have high wellbeing? Because if high wellbeing is the pathway to higher productivity, then surely we've got to go after high wellbeing in the workplace. And wellbeing is a construct of two elements: functioning well and feeling good. And to get to feeling good, you've got to function well. And there's 3 elements really, or 4 elements really, that are a requirement within work. Autonomy. So that sense of being able to make some decisions, having some control over my life, having control over things that impact me at work. So autonomy is really, really important. Competency and mastery, getting good at stuff, learning and growing, making mistakes and learning and growing. That relatedness and connectedness. Now, that's not only the fact that we are wired as humans as to be tribal and to hang out with people and like hanging out with people. That's really, really important, but it's also meaning and purpose, which speaks to the heart of good work. So what is the meaning and purpose of the work that I'm getting to do, and also the people that I get to hang out with? And the 4th element is around psychological safety. If I don't feel safe to be my full self at work, to speak up, to ask questions, to challenge respectfully, and to make mistakes without fear of retribution, you will never get productivity out of me. So these elements are the foundations of humans, human wellbeing, psychological needs. They are known as basic foundational psychological needs. And I think what we do within workplace mental health and wellbeing is to get it way too complicated, and we should be focusing in on these elements here. And that is the pathway to productivity. The other element about productivity is you've got to have the right tools and resources around you. So things like looking at your workforce and have you got the right ratios of workers to get the job done? Have you got the right systems and processes and tools that you're providing for people? So that is certainly a second element to this. But for me, the big missing piece in our conversations around productivity is we're not going back to wellbeing. And what does it take for each of us as individuals, as well as collectively as teams and groups of people working together, that interpersonal relationship piece? What are the things that we need to do to unlock incredible levels of wellbeing at a team level to allow for productivity to happen?
Wonderful, Marga. I want to just continue on that line of thinking about some of the points that came up earlier about the changing nature of work. Alex was talking about the shift. Liam was talking about that. Karen, if we look across workplaces, there are variable types of work. There are variable exposures to risk. There are large and small organisations, and of course, it's a global economy, and there is much diversity around the world in terms of systems that protect workers. Where do you think which workers, workplaces, or jobs do you think present the greatest risk to mental health?
Yeah, I mean, that's a really interesting question. And what it comes down to is some of the concepts actually that Margot is talking about, the demand, the control, and the support. So actually it's about the mismatch between those ingredients. So a brain surgeon who's had fantastic training will spend 4 hours resecting a tumour from the brainstem that could kill the patient at any moment and do it competently without stress because he has the appropriate resources and has the appropriate training and support. Whereas the poor guy that's working in the car park, who's being shouted out on a daily basis because he has to give out tickets or make people's lives difficult by moving them on when they want to stop, can have very little resources to support him, and in consequence there's a mismatch and he's very stressed by his job. So what I'm saying is any work environment can be particularly stressful. And I think we've talked about old-fashioned workplaces where it was very physically demanding. I'm not saying that those guys weren't equally stressed and fed up at the end of their days as well. It's just we didn't prioritise it or think about their risk too much. To be really honest, you can be mismatched in any particular working environment. Some are likely to be more stressful than others. I think being in the gig economy with 3 jobs that are 0-hour contracts, 2 children who need meals on the table and you don't know how much money is coming in, and your husband disappeared a few months ago, you are going to be stressed out no matter what your job is. So I think those are the things we have to think about rather than the jobs per se.
Liam, I wondered if you could pick up on that. Like lots of conversations you and I have had, you are recognising that the voice of the worker needs to be represented in a lot of the discourse that we've had around workplace mental health and well-being. Just reflecting on the voice of the worker, which workers are at greatest risk? I mean, picking up on some of the points that Karen made.
So firstly, I mean, I think job demands and resource is the number one issue, and it was the number one issue when we were dealing with physical hazards in the workplace. It was about, how fast the production line goes and whether it's appropriate given the physical hazards that would, and indeed psychological hazards that would present. But in terms of, worker voice, I want to be really clear. The best work is coordinated with workers. Workers understand the tasks better than the boss does. I think we all know that as people who work for other people, that when it comes to working out how we're going to do a job, workers are the best ones to discuss this with. And workers have different agency in that. If you're an insecure worker, if you're a labour hire worker in a workplace, you feel like you've got very little agency in terms of how you might be consulted and how you would organise work. If you're a unionised worker where you feel that you can step forward, raise issues respectfully, it is a very different beast when it comes to how we address psychosocial hazards and how we increase the protective factors of work. So I think the way I think about this as someone who has been a union official for 20 years is it's about power and agency in a workplace. And it's not just about leadership in terms of showing by example, but empowering workers and recognising that you want to get the best out of everybody and that requires them to have an equal say in how work is designed and organised.
I mean, Liam, I love that concept that the worker, the person who's doing the work, knows best how to do the work. And of course, when we're talking about lived experience, which we were in the next room, and the critical importance of lived experience in informing mental health systems and so on, it's a parallel here, right? The critical importance of having the person who actually knows best how to do the job as safely and effectively as possible to be strongly engaged. Alex, I want to shift gears slightly and think about the fact that we were talking earlier about the fact that mental injuries in workplace are rising, and we want to think about how and Liam made the point how it's critically important to reintegrate people who have sustained mental injuries in workplaces back into work, because as Margot described as well, work plays a really crucial role in a person's identity, the sense of connection and so on. What's some of the ways in which we could be supporting workers with work-related mental health conditions to reintegrate back into workplaces?
Yeah, thanks, Shantha. So this is an area that I've spent a bit of time studying, and it's some good news. Yeah, it's good news here. We know what can work and what does work in many circumstances. So some simple examples, I think, picking up on what Liam was saying before. Often we see people with work-related mental health conditions taking a long time off work, and when we run studies of employers, qualitative studies, we often hear that people in the workplace are concerned about contacting a worker when they leave work with a mental health condition, because they might be concerned that it's going to exacerbate it, or they're not sure what their sort of legal position is with regard to contacting workers. But actually reaching out and speaking to someone is a very powerful, positive thing in most cases. And we also have good clinical evidence about the return to work interventions that work for people with work-related common mental health conditions in the workplace, like depression and anxiety. We have multiple trials internationally and systematic reviews of that evidence that show that if we do things like work-focused cognitive behavioural therapy, we can get people back to work more quickly and more sustainably at lower costs than usual care or alternative forms of treatment. So we actually have some tools at our disposal, I think, that we can use to help reintegrate and return workers more quickly. The challenge that we have, and it's a particular challenge in this country, but it's not unique to Australia, is actually I'm not confident that we have our systems set up in a way that enables us to put those sorts of things into practice. So trying to think about, for instance, how we would offer a program of work-focused cognitive behavioural therapy in Australia equitably to people who have mental health conditions that keep them out of work is actually a very challenging thing to do when we partition return to work approaches and funding through a whole range of different systems in society and deliver those services in a whole range of different ways. It's a very complex, incredibly fragmented sort of landscape to sort of layer over one of these programs of support on. So while we know what works, actually the challenge is with implementing that in our settings, I think.
Is that why, and Alex, I'm going a little off script here, but is that why Liam's point that it takes 4 times long, that people who have sustained a mental injury are they're out of work for 4 times longer than those who have sustained a physical injury on average? Is that why it's taking much longer to get people? Is it an implementation problem there?
That's a can of worms about why. So that statistic comes, I think, from workers' compensation statistics, right? And so there's all sorts of things that occur early on in a workers' compensation claim that are potentially adverse to someone's mental health, and that can exacerbate the duration of time that they spend off work around the administration and investigation of the person's claim. And we can go into the detail if you like, but those are the sorts of things that contribute to longer periods of time off work, not just for people who have what we sometimes call in workers' compensation a primary mental health condition. The reason that they're off work is mental health, but also people who have physical injuries who may then experience symptoms of mental illness or even develop a mental health condition in the course of their claim, which is increasingly common, and we're seeing a lot more of that as well. Those people also tend to have a lot more time off work and be more costly to workers' comp systems. But workers' compensation, I think, it's really just the tip of the iceberg. It's the bit that we can see because we have data systems and social protection systems that capture that information and put dollar figures on it, and we can count it. But there's so much more below the surface that filters out into other systems that's managed by employers or other social protection systems or our healthcare. And that's the bit that I concern myself with more, because I couldn't tell you what's going on in a lot of that. Maybe Margot and Liam can, but
Yeah, I might just touch on that. So you're absolutely right. This is the tip of the iceberg. When we think about workers' comp claims, they're about 7% on average, or maybe up to 9% nationally. Some schemes a bit higher. But actually our own research shows that about 1 in 5 workers experience a work-related mental health issue every year. And so we're only capturing a small fraction of those, because about 9 in 10 don't even bother making a workers' compensation claim, because the way in which workers' comp works for mental health is actually different to the way in which it works for physical health. It is not a no-fault scheme necessarily in the same way. But to your point about what's driving the long periods, I touched on it before. The common sort of mental health issue is described as interpersonal conflict. And so the default employer response is to say, well, if there's an interpersonal conflict, we need to make sure that you don't come back in and have that interpersonal conflict. That is not what has driven the injury. What's driven the injury is the systems of work that have given rise to a culture that is creating those sort of behavioural change, the behavioural issues. And so what I would say is sort of people that are concerned with the system, and indeed public health advocates, is that we want to work further upstream. We need to address job design rather than make this just about individual behaviours, because that is just, a symptom of poor work design.
Can I add to that and just say that I think one of the other elements that I certainly see in the workplaces I'm in every day is skill, confidence and capability of, particularly of leaders, that one-to-many relationship that leaders have, that we put an enormous amount and growing amount of expectation on leaders. Oh, leaders will do this, leaders will pick up that, leaders need to do this, leaders need to do that. I mean, it's universal that leaders need to kind of pick it up. And what we're not doing is not developing people as they're coming through work systems into people leadership roles. We're not helping them develop the skills to lean into what potentially could be interpersonal conflict or issues or complexities or challenges early enough. So we need to have leaders who step in when everybody else is kind of wanting to step out. And I fear that unless we really help and support leaders with some fundamental skills around good people leadership, the soft skills as they're terribly called, but the soft skills that are the harder skills, we are absolutely going to be only contributing to this rise of injury that is happening, whether it ends up in the workers' comp system, the life insurance system or the benefit system of welfare or anywhere else. We are only going to be contributing to that. So I think we've got to pay particular attention to how are we not only building technical capability, but look to the skills of the future. And the World Economic Forum has really highlighted 8 out of 10 of the skills of the future are emotionally, psychologically based. So we are not developing the workforce of tomorrow if we're not addressing emotional and psychological capability of leaders in particular.
So we in educational institutions have our work cut out for us, because clearly we need to rethink how we're training the workforces of the future as well. Look, folks, we're drawing to an end to this session, but I want to put to the panel just one last question, and that is to look to the future. We heard from a number of these panel members that there are challenges. We have considerable fragmentation and complexities that are evident in this area of workplace mental health and wellbeing. But there are also, we know a lot as well, and there are some opportunities. And one of the things that you see flagged in the session description is that an idea here in Australia is to bring a consortium together, a consortium that represents multiple stakeholders that are going to be able to drive forward a new agenda in this space of workplace mental health. And I want to ask, and I'm going to start with Liam, if we were to bring a consortium like this together, really to take national leadership, what would you like to see in terms of gaps that this national centre will fill?
Well, I think the biggest thing for workers and the trade union movement is elevating workplace mental health as a priority for the country. I think we see a lot of debate about mental health, and as you've heard from each of the panellists, work is a significant contributor to it. Research indicates between 15 and 45% of mental ill health has some work-related factor. So it is a significant driver, but yet we are not in any way joining up and coordinating our efforts. And so I'm very conscious that with mental health and work-related mental health, it is much more of a continuum than, say, physical health and safety is. You know, to Karen's point, you know, it is a 360-degree issue. It is something that you bring to work, and it's something that is much more complex than necessarily just designing a safe system. So the biggest challenge for us is to raise its prominence. And I think that's the key thing for us to see in a national centre, because it is a significant issue. I mean, it is, as I said, the only rising, outside of respiratory illnesses caused by things like silica and other things, the only rising work-related injury we've got in the country, which really for a country as well off as we are, we should be seeing declining rates of all injuries.
Thanks, Liam. Margot, can I ask you from your perspective what you would like to see, what gaps would you like to see this a national consortium centre fill?
So I think in addition, I'm going to build on, because I'm 100% in agreement with Liam, the opportunity for implementation support. So given workplace mental health and wellbeing, the relatively new legislation and the shifts in just generational expectations, worker expectations, a whole range of factors that make this complex, I think the pathway forward is to recognise we need to support employers and workplaces and leaders and workers with implementation support. What works in your setting? How do you measure it? How do you know it's working? What do you do to fix or change or modify it so it's working even better? How do you engage your workforce in co-design and collaborative approaches, and rather than top-down, so that it sticks? We have sustainable change that we're measuring. So that implementation support for me is really, really important. I think Karen said earlier that we absolutely know what works, and we do. We've got a truckload of fantastic resources, tools, programs, initiatives, trainings, etc. that are available. But most employers I talk to don't know where to start, don't know what to do, and want help in how do I create a mentally healthy workplace that is going to build the wellbeing of my people, the engagement of the workforce, but also lead to increased productivity and profitability. And I think implementation support is a really key thing that this centre could potentially really solve too.
Wonderful. Well, you've heard from this group of experts here that there are significant challenges facing us as a community here in Australia, but also globally in the area of workplace mental health and wellbeing. One idea here that's emerging in this area is to develop this multi-sector, multidisciplinary consortium that would come together to rebuild the systems that we require to protect workplace mental health and to create mentally healthy workplaces. Really, this is a call to action for all of us working in health to recognise that work needs to be in a health-related context. We need to create healthy work and healthy workplaces. That is the challenge to us, recognising that most adults will spend a considerable amount of their time in workplaces. And as Karen said earlier, that represents a challenge if workplaces are unsafe, but also an opportunity in order to promote health and mental health. So I want to conclude by thanking this fantastic group of panellists that really represent collective years of experience from academia and in practice, and representing unions, workplaces, and so on. Thank you to you all for joining, but please join me in thanking the group of panellists and really put out the call, I think, that Liam has put out to us, that we need to elevate the importance of workplace mental health and the need to create mentally healthy workplaces. As this group of panellists has identified, we all play a role in doing this. And so thank you for joining us, and take that call out with you wherever you're going. Thank you.